today's shifting and often complex healthcare environment, personal health literacy stands as a very important skill to have. It involves understanding how to locate and effectively utilize the healthcare resources available to you as a patient. These skills can translate to making better informed decisions regarding your health and the health of those you care about. The European Health Literacy Consortium defines health literacy as linked to literacy and entails people's knowledge, motivation, and competences to access, understand, appraise, and apply health information in order to make judgments and take decisions in everyday life concerning healthcare, disease prevention, and health promotion to maintain or improve quality of life during the life course. There are other definitions available, but many of them tend to stray towards this general theme of accessing, understanding, and applying health information. A grasp of basic health literacy can lend a hand in the following tasks: communicating one's concerns and questions effectively with medical professionals, understanding how to read and interpret a prescription so the medication can be taken as intended, differentiating between credible and non-credible health-related information online, weighing the risks and benefits of critical decisions pertaining to one's health. Individuals with limited health literacy skills may experience difficulties with the aforementioned tasks, and thus may be at higher risk of health-related problems. Examples of groups of people more likely to have limited health literacy skills are recent immigrants and refugees, economically disadvantaged people, people with language barriers, the elderly, people with lower levels of education, and people with cognitive impairments. Understanding the demographic variance in health literacy can be a very multifaceted discussion. As the World Health Organization explains, capacity and competence related to health literacy vary according to context, culture, and setting. They depend on individual and system factors. These factors include communication skills, knowledge of health topics, culture, and the specific characteristics of the healthcare, public health, and other relevant systems and settings where people obtain and use health information. When these services or systems, for example, require knowledge or a language level that is too high for the user, health suffers. Raising public understanding of healthcare literacy is the responsibility of multiple parties that include governments and sectors relating to healthcare. However, individuals can also take action to better their own skills. Steps a person can take to improve health literacy skills include writing down or recording information from their healthcare providers, asking providers to speak in a more simple language, avoiding healthcare jargon. If they're having trouble understanding something, the patient should let their doctor or healthcare provider know so they can explain the information to them using language the patient can understand. Asking questions when something is unclear and being sure to know who the patient can call if they have questions after an appointment. Being actively aware of patient resources available to them so they can be used when communicating with healthcare professionals, such as lists of standard questions that can be asked. Other ways of improving one's health literacy include providing feedback on websites that are unclear, consulting with staff at your local library about locating healthcare information, and taking classes on digital literacy that might be offered through your local library or other reputable organization. Attending health education programs hosted at local hospitals, public or hospital libraries, community centers, or faith-based organizations. Enrolling in language courses for those less familiar with the language used by healthcare personnel. Finally, know that building health literacy skills is a lifelong process and that no one can be up to date all the time. Thus, it's important to keep an open mind on what you might know now and what resources you can refer to best assist you in your situation. Health literacy is an important skill to have. With enough background, one can effectively unpack their medical concerns and work with medical professionals to ensure that they are receiving the type of care and treatment most appropriate to their situation.